And welcome. We are here at Deuk Spine Institute. We're going to be performing the Deuk laser disc repair. Our patient has 5 spots that need to be fixed in her back. 3 on the right and 2 on the left. Shot. Now when she originally came to us, she had, you see the problem there, Jordan? She had just right leg symptoms. But more recently she has both leg symptoms, and we ended up adding on her left. How's she doing, Dr. B? All right, that looks damn good. Shot. Give me an AP. Let's see where we are. Knife. We're going to make our incision, and we're going to be performing this same thing at 2 other levels on this side. Perfect. Lateral. Needle. All right, if you have questions, feel free to ask us. We're just going to keep working. We've got a lot to do in a short amount of time. Shot. This patient is asleep with sedation. Shot. Let's see. Shot. I'm encountering some abnormal facets. Facet arthropathy is common. And let's do another AP. We're going to try to fix all 3 discs on the right side through 1 incision. Lateral. All right, Henry, any questions? Shot?
Yes, we have a question from Lanu on YouTube.
Lanu, welcome.
Asking, are there any foods that are good for neck bones or back bones? Any recommendations?
Yes, I recommend fish. Shot. Fish is wonderful. Most people don't know much about eating fish, but fish has essential fatty acids, linoleic and linolenic acid, shot, which your body has to have. And people don't get enough of that. Shot helps build healthy, strong bones. All right. Now she is a local girl, right? She's from, huh?
Yeah, Florida.
Shot? Central Florida. So she's not too far from where we are. Today we had a couple of Floridians join us in the operating room. Shot. 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 I'm trying to get to the L4-5 next. Shot. And can be a bit challenging, shot, especially when you have arthritis of the facet joint, which she does have. Shot. Now we don't need to do anything about her facet joint arthritis because I don't think that's a problem. We need to fix her discs. Her big issue is her legs. She's getting pinched nerves on both sides. She wants those pinched nerves fixed. So that's why we're here today, to give her some relief of her pinched nerves. See that bone spur right at the tip there, huh, Jordan? Shot? All right, let's go to the other side. So on the other side, we're doing 3, 4, 4, 5, correct? On the left. You all right, Dr. B? Shot. Shot. Her spine is actually quite posterior. Meaning unlike some of our patients where their spine is really far forward. Hers is actually backwards towards us. So I'm not having to struggle as hard as I do in some patients to get to the front of the spine. Sean? But I'm just about at 3-4. Sean? Give me AP, please. Very nice. And back to a lateral. Great. Let's get that lateral view. Very nice. Can feel the herniation is quite large. Shot. Shot. As I said, her spine is actually quite posterior. Shot. Shot. And there's my lovely hand. Shot. All right. That's a little better. Any questions from our audience? If not, let's show them, Shot, our video on, I would, that's the latest right there, Jordan? Shot? Everything okay, Burndas? Yeah. Shot? Man, just a little bit of angling really gets you quite a sweep on that needle. Shot?
We do have another question
Sure, I'll take it.
coming from Lanu once more on YouTube,
Of course.
asking, is milk good for the bones or not really?
Milk is good, but you have to have it at an early age. Having it later in life is not as helpful. All right. So I've got every needle in position except for maybe 1.5. Shot? Shot? She ready to be woken? We don't have to wake her if you don't want to.
Can you open your eyes for me? Good. Okay, don't move. You're
Wait,
fine. Keep your
bottom
eyes
one.
open. We're going to ask you some questions. She's doing fine.
You okay?
She's okay.
5-1 is the only one that I'm struggling a little bit with because of the angle. Shot? But I think we're in. Are you comfy?
Yes.
All right, you're doing great. Everything's fine. We're going to put you back to sleep in a minute. I just wanted to check something, okay? How long have you had back pain for? How many years? All right. 3 years. Sorry, my writing is so bad. How bad is that on a scale of 1 to 10? How high?
Give us a number. What'd you say? What?
20? All right. 20 over 10. Is that where you get your pain?
Yes.
So we call it concordant. Put a C. Is it better now? Is it better? All right. How bad is that on a scale of 1 to 10? How high? 20? Another 20. 20 over 10. So that was 3, 4, 20 over 10, 4, 5, 20 over 10. And that's where you get your pain? Is that where you get your pain?
Yes.
Yeah. Concordant. The only one we haven't tested is the bottom disc. We're going to test that in a second. All right. Let me pull back a little bit. Oh, yeah, got it. How bad is that on a scale of 1 to 10?
8.
What's the highest it goes? She's talking a little too much, but we'll just put 8. 8 over 10 at 5-1. So I think it was worse than A because she jumped. But I couldn't get any dye to stay in the disc because it all leaked out. So I couldn't get any pressure. Shot? What are we doing first? 4, 5? All right, that's fine. Okay, we're going to put some numbing medicine and our patient's going to go to sleep. Now, we are fixing 5 areas. We call it bilateral. On 2 of the discs means left and right, and then shot. And then we're going to do the right side only on 1 of them. Shot. Any questions?
Yes, we have a question from Robin on YouTube.
All right. Let's, before we run, actually, I'll take the question, and then Henry, if you don't mind, I would love for us to, show maybe Zach's video, the old video, on how these disc herniations cause back pain.
Not a problem?
Her main problem isn't back pain, it's a pinched nerve going down her leg. So she's got leg symptoms, pain, weakness, numbness, and that comes from the herniated disc. Herniated disc. She has 5 of them. Actually, she has more than 5, but 5 of them are causing about 95% of her symptoms or more. Everything okay? She's doing great from my standpoint. All right, let's take our question.
Question coming from Robin on YouTube asking, what is spine posterior mean?
What is spine posteriorly?
What does spine posterior mean?
It means the back of the spine. Posterior means back, anterior means front. So it means the back of the spine. You're probably reading from your MRI report, and it just means the back of the spine. Or if it says protruding posteriorly, it means sticking out towards the back. That's a good question. I don't think I've had that one before. I apologize. Yeah, okay. You're talking about my comment. Yes. Posterior means towards the back, towards this area back here. So her spine is in her body more towards the back of her body. A lot of people's spines are towards the front, but it's something that nobody talks about, and that is the position of the spine in the body. The more anterior or forward the spine is, the deeper I have to go, and it's a technically more challenging surgery for the surgeon. These are all pieces of herniation. The more posterior the spine is, the closer it is to where we are. So you don't have to go as far to get to it.
Robin commented, no, you had mentioned spine is quite posterior.
Yeah, I understand. I think I just answered her question.
Yep.
Nikki clarified it for me.
Okay.
Yeah, her spine is posterior, meaning it's towards the back towards her skin in her back, not towards her belly. Again, everybody's spine's different in the sense of where it lies in the body. Any other questions?
Yes, we have a question from Lanu once more on YouTube asking, there are supplements for the bones. Do you recommend any of them, or they're just gimmicks?
No, supplements are gimmicks. We get this question a lot. The only thing that's ever been proven to give strong bones in adulthood and reduce the risk of osteoporosis, osteopenia, osteoporosis, is weight-bearing exercises when you're younger. You know, when you're in your teens. Did you lift weights or do weight-bearing exercises? So I think the best is going to the gym and lifting weights. That's it. Nothing else has ever been proven to help with bone loss except for prescription medications, which you know, a lot of people have to take when they have weak bones. Great questions.
At this moment, no current questions.
Thank you, Henry.
Not a problem.
All right, let's show the audience how what we're doing is helping this patient, not just with removing the herniation to unpinch her nerves, but to also help her with her back pain.
Disc injuries are a common cause of chronic back pain.
All right, welcome back. You can see from our video how the laser cleans the tear of the damaged disc to allow the disc to heal naturally. With this technique, there's no need for fusion or metal or cadaver bone. Nothing unusual or abnormal is put in the patient's spine. It is a natural repair.
We have another question.
I will take the question.
This comes from Tony on Facebook,
All right.
asking, have you treated non-discogenic radiculopathy?
Have I treated non-discogenic radiculopathy?
Correct.
I had to repeat the question. So let's talk about that. Radiculopathy is essentially abnormality of nerve root function. And it happens because the nerve root is either pressed on or irritated, so compressed or irritated, and the compression is structural compression by something around the nerve root. Irritation is chemical irritation, usually inflammatory, by something around the nerve root. So what are the causes of radiculopathy? Well, the most common is stenosis or narrowing, and that is due to the herniated disc. 99.99% of the time, unless you have a tumor, which are very rare, by the way. The other possibility is that they have a very enlarged facet joint, but a normal disc. That's extremely rare. I see that like once every 5 years, and that could cause radiculopathy. But that's about 1 in 1,000 cases, maybe more, 1 in 2,000 cases. So the vast majority of people that have radiculopathy have a herniated disc causing it, and that's about 99% of the time, 99.5% of the time. The facet joint can be a source of radiculopathy. If you've had surgery and they put a cage in and it's moved or it hasn't been put in properly, that could be a source of radiculopathy, the cage putting pressure on the nerve root. A foreign body, like a stimulator paddle lead or something that was put in by a doctor, could be a source of radiculopathy, but those are very rare causes. The vast majority is the herniated disc. So I'm curious, whoever's asking the question, God damn it, what source of radiculopathy they're talking about. Do they have a source, or are they just asking?
I think they were just asking.
Yeah. So the answer is, yes, I have treated it, but I'm not sure where they're going with this question. Is this just a hypothetical?
I believe that was just kind of off the whim, just kind of.
Well, I mean, I don't mind answering questions about odds and ends, but they need to understand that is like asking if I've treated somebody who has a spine injury from an asteroid hitting them. That's almost the same question as have you treated non-discogenic radiculopathy.
They just commented, I have L4 to L5 fusion T-lift. Went great. 1 year later, I developed radiculopathy, normal MRI, EMG positive.
Oh, okay. So they're calling it radiculopathy.
Yeah.
But it's not necessarily radiculopathy. Yeah, the reason you're having those symptoms, number one, either your MRI is not normal, even though they're calling it normal. You have a disc herniation, they're just missing it, which is common, happens all the time. We will not miss it at Deuk Spine. So my advice, get a free MRI review, find out what's causing your quote-unquote radicular symptoms. Second most common reason is that you have a piriformis syndrome, spelled Piriformis. Piriformis syndrome. Second most common cause of these sciatic type symptoms in patients. That's probably what you have going on, if I had to guess. But like I said, you get a free MRI review, you might as well take advantage and get the answer. Don't just, make me guess in the operating room. Let me look at your MRI. Let me see you, and I will tell you why you have radicular symptoms. Okay? It also requires a history. For example, when did it start? Did it start when you woke up from surgery? You woke up and you had it? Or was it there before? Or did it develop after surgery? Like weeks or months later, right? That's important. Because if it happened when you woke up and it wasn't there before, then the surgeon obviously did something to your nerve while you were sleeping. Like accidentally did something. Or intentionally. There are wackos out there, right? The other possibility is that you've developed, fucking herniations. This won't float out. Damn it, don't grab so hard. You don't need to. They're not sticky, okay? They're just there. So all you need is a light grab. If they're sticky, you do a hard grab. Yeah, get answers. Don't get guesses. You cannot diagnose yourself. I can diagnose you. You can guess, but you're not qualified to make that diagnosis. Unless you're a spine surgeon, neurologist, physiatrist, neurosurgeon, which I don't think you are. More herniations, look at that. Just about done with L4-5. Right, Louise? These are some big pieces of herniation. They're just literally the perfect size not to come up the tube on their own. They need a chaperone. All right, we're done here. Scope off.
We have another question.
Of course, I'm happy to take your questions.
This is coming from Lanu, once more on YouTube,
Yes, Lanu. Sorry, Luis.
asking, can losing weight reduce the chances of getting back pain?
Nope, it doesn't. Weight has nothing to do with back pain. It's misinformation. It's something that you hear all the time. Oh, fat people get back pain. But I can tell you right now, lots of people get back pain. Fat, skinny. The reality is, I've been treating back pain now for 26 years. That's all I treat, back and neck pain. And has nothing to do with how fat you are. We get skinny people, we get fat people, we get medium people. I've never seen a correlation. The problem is, to be honest with you, Sean, is that most doctors don't know how to fix back pain. And patients want to know answers like, why do I have back pain? So the doctor can say either, I don't know, and look like an idiot to the patient, which no doctor wants to because their ego will be hurt, or they can say, because you're fat, which if they say that, then it's the patient's fault that they're having back pain, and there's nothing the doctor can do about it, right? It's the patient's responsibility to get it fixed. So basically, it's an excuse that doctors have come up with over the years to avoid facing the truth, which is that they don't know why the patient has back pain. Because, I mean, let's face it, doctors don't know everything. But they don't want to tell the patient that. You know? I have no problem telling patients I don't know. And the reason I don't have a problem is because I know a lot more than my patients do. And I take comfort in that fact, but I don't know everything. And I'm perfectly fine admitting I don't know everything. And if you sit there and say to a patient, lie to them about their weight being the reason, then what happens is they believe it's their weight, and either they do something about it and get rid of the weight, but then they still have the back pain. You're going to hear some stories once in a while. Oh yeah, I lost some weight and I got better. But I think that's just coincidental. I think it's more related to something else like biomechanics. The activities they're doing. So, but, you know, feel free to lose weight. I mean, I guess as long as you're, if you are fat, overweight, and you lose some weight, it's probably okay. Wouldn't hurt you. But I would bet 9 out of 10 you're not going to get rid of your back pain. I mean, this patient's not fat. The next patient we're doing today is not fat. And he comes from Canada, Manitoba, right? He's skinny. You'll see. He has horrible back pain. Anyway. Great questions from our audience. We are working on disc number 2.
We have another question.
Yep.
This comes from Lanu once more on YouTube, asking, when a person with herniated discs travel to far places like Australia, do you recommend first class or economy class, or it doesn't really matter?
Honestly, it doesn't matter. I always recommend first class. If you're going to travel that distance, enjoy yourself as much as possible, if you can afford to do that. But it really doesn't matter in terms of the surgery being done and the recovery, and should I be first class laying down, should I be sitting up. I think you'll probably be more comfortable laying down. I know I am. I don't have back problems though, but I think you'd be more comfortable laying down. And I just think if you're going to splurge on first class, this is the time to do it, like after your back surgery. So maybe do an economy ticket over and a first class back, you know, unless you can afford it both ways. And in which case I would do both ways if you can. But yeah, I think a first class return ticket would be a better option for you. These fragments are just not coming out on their own. I don't think you would ruin the work I did if you sat. I mean, but it is a long distance, and sitting 100% puts more pressure on the disc. So if you did economy on the way home after laser surgery on your disc, then you're going to want to be getting up, you know, during the flight, and you're going to want to walk around. Well, there's the problem right there. You guys see the inflammatory tissue?
Yes, we do.
Yeah. So this is not only inflammatory tissue causing her back pain, it's also putting pressure on her nerves. See this stuff right here? This is literally crushing her nerve every time she gets up and walks. We're on the right side. Go ahead, Henry.
I was going to say no current questions, so we do have a comment from Rita on YouTube.
Buddha?
Rita.
Oh, okay.
Rita said, "You are so honest. I had a friend who was overweight but never had back pain," he said.
Yeah. Well, I try to be. I don't know why people are not honest to other people, but I have nothing to hide from you guys. I want you all to do well, get out of pain. Ever since I was a little kid, I saw people suffering and I wanted to do something to help them. Can't help them all, but I can help those with back pain. So this disc is what? 3/4? Yeah. And you can see we're almost done. It wasn't as many fragments as the last one, but right here where I'm working exactly right now, this is the back of the disc. This is the part, there's a piece of herniation. This is the part that's really hard, like one of those little rubber balls, bouncy balls you used to buy in the 25-cent gumball machine and bounce it on the ground. Super ball. This is what it's like. It's super rubbery and firm. And you could see those fibers right there next to the laser, the white fibers right there. That's the back of the disc. That's the posterior ligament. And right behind them is the nerve. And so all of this is just pushing back, crushing the nerve root. Okay? So I'm removing a lot of it. I'm never going to get 100%. Nobody can. But we're going to get as much as I can. In the end, it's usually around 50%. All right, we're almost done. 30 seconds on this disc, and then we'll move on to the next one. Almost halfway there. Any other questions, Henry?
At this moment, no current questions.
Great. That fat you saw right there is the epidural space.
No current questions, but we do have a comment from Rita once more on YouTube.
Yes, Rita. Thank you.
They said, "I envy your Manitoba patient. I'm from there. I think because of Takayasu there waiting for me to pass, so they won't help financially or give approval. I keep trying. God bless you."
I'm so sorry. Yeah. I wish we didn't have to take money from you, but unfortunately, can't pay bills without money. So, but God bless you, and I hope you get better on your own without needing us. To be honest, since we're wishing, might as well wish for the best. You don't need surgery, right? Look at that. See that metal right there? Anybody know what that is? All right, does that mean this patient has a piercing of their disc? No. That's the needle from the other side. Remember I told you we're going bilateral. Good job, Mickey. Can't pull the wool over Nikki's eyes. Scope off. Where's the other? Yeah, it's just a sniff. Let's wash it out. Oh no, the water, irrigation. That's not num-num, right? All right, take that. And you ready? Yeah, I mean, I agree with you. Our patients are fortunate that, come on in, Jordan, that we actually are able to treat them. Watch it. I think someday everyone's going to get this treatment. And that will be a great day when the people that need it get it. And there's insurance companies can't deny back surgeries or MRIs. Dr. Berndes, how you feeling? All right, very good. Shot. We're heading down to L5-S1. Shot. This is the bottom disc, and she's got a badly pinched nerve here on this side, right side, not on the left. Shot. Shot. Come on, Jordan. Shot. Uh-huh. Excellent. All right, we're in. This is our last disc on the right. We're going to move to the left next. And, you know, she has an interesting story. I'm not going to tell you who she is, but she actually came here last week. She was supposed to have the right side done, and she got in the pre-op area, and she goes, you know, my left leg is starting to hurt. I said, well, what's going on? She goes, I think I have herniations there too, but I wasn't having any problem because I had an epidural, and the epidural took my left side symptoms away, but now they're coming back. She said, well, fixing the right side fix the left side symptoms. I said, no, most likely not. You know, there's a small chance it will, but likely it won't. She said, in that case, I don't know that I want to do this right now. I said, okay, I gotta see, guys. I really want my left side fixed as well. I said, okay, well, let's meet and talk about it. So we ended up meeting a couple of days ago in the office, and I reevaluated her and found two discs that really need to be fixed on the left side. And so we added those two discs, and here we are today. Instead of doing 3, we're doing 5. And that's how the cookie crumbles sometimes. All right, just about done with this side. Once again, we've done 2 on the third. This will be a quick one. Apologize for the poor visibility, but that is a little oozing from her bone, from her end plate, because she's got so much inflammation at this disc. That inflammation brings new blood vessels, and makes things bleed more. Questions?
Yes, we have a lot of questions. This next one coming from JG on YouTube,
Hi, JG.
asking, after your laser disc treatment, is there a follow-up appointment in person or remote? How many days after surgery?
Yeah, JG, we have no follow-up appointments. There is no need for follow-up because we're not putting metal or fusing or doing anything invasive. So patients don't have to come back. You're welcome to have a follow-up appointment if you want it. All you got to do is ask. About 10% of our patients will follow up. They have some ache and pain they have a question about, or a new symptom, or something else going on and they want answers. But 90% of our patients we never hear from again. I think that's a good thing. I mean, I love hearing from my patients, but you know, they move on and they just get on with their life. I personally won't call my surgeon unless I have a problem. So when I have a problem, I call my surgeon. And most people are that way. So we're available 24/7. I give my cell phone to all my patients that I operate on so they can get me anytime they need me. But I don't, you know, I don't encourage them to call me and ask me things like, oh, I had some, you know, burping earlier today. Is that okay? You know, obviously they need to reserve their questions for serious things, but they have my phone number nonetheless. And, you know, some of them end up saying, oh, I got to have my teeth extracted, or I need some dental procedure. Do I need antibiotics? You know, I get questions like that. But for the most part, no, there's no follow-up, and you don't need to keep coming back unless you're having a problem. And like I said, 10% of our patients will call us and want to schedule a Zoom. And we do everything by Zoom. They're welcome to come in and see me in person, but you know, it's not convenient for most people as they travel. All right, next question.
Next question coming from RJ on YouTube,
Yes, RJ, thanks for asking question.
asking, how much does it cost for this procedure? I have an L5-S1 herniated disc, which is causing crazy sciatica pain on both sides of my buttocks, legs down to my ankles and toes.
Yeah, great question, RJ. It really depends on what we're doing and the pre-op clearance, you know, testing that needs to be done, and there's a lot of factors. But the way you get pricing is by doing what's called the MRI review, and it's free. We don't charge you for it. But after the MRI review, we'll know exactly what's wrong. We'll know exactly how to fix it, and we will give you the cost. I don't have the pricing. I have a team of schedulers, and they deal with all the insurances and pricing. So that's how you get your pricing. Let me see the grabber. About 2 minutes on this disc, and then we're going to go to the other side.
We have a couple more questions.
I'll take them.
Next one coming from Robin, once more on YouTube, asking, I can imagine the joy patients feel being able to walk again. Quite an emotional, traumatizing experience. Do they get emotional when waking up from the miracle they received?
Sometimes. I think the nurses spend more time in recovery than I do with them. What do you say, nurses? Do they get emotional in the recovery room? She said absolutely. Yeah. because I just poke my head in quickly in the recovery room, and then I see them sometimes the next day, and yeah, they're definitely very happy. 90% of our patients, the pain is completely gone the next day. And 10% of our patients need a few weeks for the soreness to go away from the surgery. But yeah, Henry, you can put a testimonial link,
Yeah, not a problem.
and you can watch the testimonial. All right, I think I'm going to try one more pass here, and then we're done. This is 5-1 on the right. A lot of scar tissue, and what I'm seeing that's bothering me is this calcification, this calcium deposit. But I've really cored out as much as I can. The nerve is right over there, and that fat, that's normal. It's normal for the nerve to be surrounded by fat in the foramen. We'd like to see that. No. I need the tube. Yeah. Yep. We did it 3 discs on the right, we got 2 on the left, and we'll be done. Come on in, Jordan. All right, keep the questions coming, Henry.
Copy that. This next one coming from the Traveling Gringo on YouTube,
All right.
asking if you needed spine surgery like the ones you perform, who is the doctor would you go to?
Great question. There's nobody in the United States I would go to. I might consider going to South Korea, and going to what I consider to be one of the best, but he's retiring or retired, so I don't know if he would come out of retirement for me. I was one of his students. He may not even remember me. Dr. Sang-Ho Lee. That man is pretty badass. At Woodidal Hospital in Seoul, South Korea. That's where I'd go. That's where I would go. I thought about operating on myself. Dr. Berndes might have a heart attack if I do that. Yeah. It is tough in the prone position. I don't know. If I could, I'd have Luis do it, but it wouldn't be legal. We wouldn't be able to broadcast it.
Right.
I'd have to promise him a Ferrari right after the surgery. I think Luis has probably seen the most of these surgeries, the most, second to me. A few more years and I'd have my son do it, my son Arias. He's going to be an incredible surgeon if he ever chooses to do it, which you should all pray that he does, because he's the future of Deuk Spine. He's an amazing human being. Incredibly compassionate and far more intelligent than I am, and his hands will be Incredible. Yeah. So there's your short list. I know, Luis, you think you could do one of these surgeries? In a pinch? Huh? Yeah? You think so? He says yes. If Luis says yes, then he can. I trust him. Yeah. All right, Dr. Berndes, I got 10 minutes on this disc and then we'll be on to the last one. How is she doing? How are you doing, my friend? You gonna make it? Don't collapse on me and make me do the anesthesia. One more to go. We're moving that last patient, so I don't care, come hell or high water. I'm not doing it. Unless Patel wants to do the anesthesia. Psh. I think Patel has done conscious sedation before. That said, he's not privileged here, I don't think. Is he? I'm not sure. I don't think we allow that, so it's not safe. Yeah. I know a lot of places do conscious sedation, but I think that's really dancing with the devil. Yeah. It's where the surgeon does the anesthesia while they're operating. They use a nurse to do it. Yeah, I mean, right? Laughing gas, not a big deal, is it? Can you hurt somebody with laughing gas? Aspiration? You know, I'll be honest, I do aspire to a lot of things myself. Is that so bad? Gotta put a smile on your face, Dr. B. No, don't aspirate to aspire. All right. So far, patient's doing really well from a surgery standpoint and from an anesthesia standpoint. She's a tough one, 5 levels. Any questions, Henry?
No current questions, but we do have a comment coming from Rita once more on YouTube.
Sure, Rita.
Saying, I pray that one day you can teach your treatment in Canada, and I pray I can be in your trial. I wish Canada would do that. You're amazing. A doctor does not give out their personal phone number.
Well, I appreciate it. Thank you. I give my number out because I want people to be able to reach me so if they have a problem, you know. It's all about putting the patient first and prioritizing the patient and their needs. I'll be honest with you. I've had a couple of treatments myself, surgeries, and I'm probably a terrible patient because I always end up calling the surgeon and asking questions, but I know what it's like, you know, when you're having an issue and you want answers and you try to call the office and they don't answer you or they don't give you the information you need or there's nobody available. So it's very important to me. I love my patients. I absolutely love them, my patients, and I want them to have the best experience possible that I can give them. So being available to them to answer questions if they are really in a nervous jam and they need to know right now, then I'm there, you know. And it's funny that the truth is, even though I give my number out to all these people, very rare do I get a phone call. I mean, it's extremely rare, or a text. But once in a while, somebody will text me and say something like, oh, is it normal that I still have numbness in my foot, 2 weeks after surgery? Yes. Yes, it is, because the nerve takes up to 12 months to heal. So it's better that I'm available to them rather than they panic and worry and do something they shouldn't do, Oh, should I go to the chiropractor? No, you shouldn't. Not yet. They can mess you up. So I would rather be available to answer questions so it keeps them out of trouble and they don't end up doing something that we regret. What's wrong? So I don't know. It's a tradition in my family that, and I thought all doctors did it, but it's been a tradition in the past that doctors are available to their patients. So it's surprising to me. I mean, all of our doctors are available. We're on call. We're ready to go. Patient calls and needs help. We're there. That's the way it's supposed to be. It's always been that way, traditionally in medicine. It should stay that way. I mean, these are people who just had surgery. They need answers sometimes right away. And tracking a doctor down can be impossible sometimes. So it's good to have a cell phone. But yeah, thank you. Thank you for appreciating what we do. All right, let's grab that. So this is one of our longer surgeries for the day. How's our cervical doing? Anybody know? Does he want to leave? Or is he's hanging out? Because if he's wanting to go, oh, okay. That's fine. In that case, I don't mind. I can see him when I'm done here. Yeah. All right, any questions, Henry?
No current questions, but we do have a comment from WD on YouTube.
I didn't hear you, Dr. Burness. Yeah, he can go. If he wants to go, he can go. Yes, I'll take Walt Disney's comment.
They said, you just answered all my questions from what the traveling gringo asked you.
Oh, all right, cool. Thank you.
Oh, and we just got a question from Robin, once more on YouTube.
Awesome. Yeah, bring on the questions, folks. I don't mind answering them while I'm operating.
Asking.
I wouldn't say that you could teach a monkey to do this, but it doesn't take a lot of brain power to do what I'm doing right now. It's more like playing a video game.
Robin,
go ahead.
From YouTube, once more asks, is it recommended to wear a brace while sleeping after surgery?
No. Oh, no. Okay, so are you supposed to wear a brace after my surgery if you're sleeping? Only if you have surgery on your neck. So cervical disc herniation, yes, brace. Lumbar, no. I hope that answers your question.
We have another question from Justin K on YouTube.
Sure.
Asking, how long before I can go back to the driving range after a surgery like this?
Yeah, great question. Driving range, if you want to really hit the ball, you need to wait 3 months. But you can go start putting in 2 weeks. Putting in 2 weeks, mid-range 6, driving 3 months. Man, that's a big piece of herniation right there. See that thing? It's just breaking up into little pieces. Almost done with this. If I can just get that thing and pull it out. Doesn't want to come out. I think I might have it. That's a pretty good size. I think there's some more pieces there though. All right. We get a lot of golfers, by the way, a lot. Nobody wants their back fused that plays golf. Saw it happen. with Tiger Woods, with his back surgery, it's a life of pain and suffering, pain pills, car crashes, bad choices, and a loss of $1 billion in valuation. Oh no, more than that. Oh, he was addicted to painkillers, alcohol. $5 billion of lost value because of a back injury that he did not come to Deuk Spine Institute for. Okay? Now, how do you know? Tiger Woods lives in the same neighborhood I live in. I tried to get him to come here. Tried. But they don't listen. I tried to save his life and his career, huh? Oh, he didn't live in Jupiter back then. He lived in Isleworth in Orlando. I tried to help the man. Was not in the cards. That's okay. All right. Just about done on this disc, and we'll have one more to go. Any more questions, Henry?
No current questions. We do have a couple of comments. This first one coming from Lanu once more on YouTube, saying, I saw someone on an airplane. She had back pain, but flew in first class. It was a huge help for her.
Yeah, it is. No, Lanu, I agree with you. Listen, I'm not arguing with you, Lanu. You're right. First class would be better, but I don't want you feeling that you have to go first class. Unless you want me to say that. I mean, if you have somebody willing to pay first class, if I say go first class, I'll say it. I'll give you a letter saying you need to go first class. I don't know if that's what you're angling for, but if the airline will put you in first class because I give you a letter, I'll give you a letter. Shit, I'll give you a bunch of letters. You can fly first class every time you fly. The reality is I agree with you. If I had a back problem, I would want to fly first class because I would want to lay down. So if you need that letter, we'll give it to you. Don't worry. All right, that's it for this one. Thank you, Luis. One more to go. Oh, just Henry, can you see this over here?
Yes, we can.
Look at all these pieces of herniation here on the blue towel. You see them?
Yes, we can.
That's just all that came out of the tube, you know? People always ask me, what happens to the pieces of herniation? Well, we get them out, you know? They get on all over here, and we're not really collecting them. We just sort of clean them up later. We send a few of them off to the lab, have them look at it, make sure there's nothing weird going on. And yeah, that's it. Check it out though. Oh, no. No. Not what I need. Cold welded. Not cold welded, hot welded. Yeah, I got the last one, Luis. This is all yours. Good luck. Is there another shot? That's it right there? You want me to hold one? Yeah. All right, so unfortunately, what I did was when I was on the other side, I must have zapped the needle one time with the laser and it melted the steel together. Oh, we got it. All right, that's pretty cool. It's a welding. We welded the freaking needle from the other side, right? I mean, that's why I laugh at these doctors who tell people, oh, laser can't get rid of bone spurs. Well, laser can weld steel with one blast. And we don't even have the laser all the way up. We have it at like 40%. Shot? So what do you think it could really do? I mean, of course it can get rid of bone spurs. We get rid of them all the time with the laser. These doctors just lie to patients. They're like, oh, you can't get rid of bone spurs with a laser. My favorite lie for patients from doctors, surgeons, is I went and saw my surgeon and talked to him about the laser surgery that you do, Dr. Deuk Majan, and he said, oh, yeah, he does that too, but that I'm not a good candidate for it. That's my favorite. But yeah, I do the laser surgery, but all right, I'll do it. But but you're not a good candidate for the surgery. That's what these guys tell their patients. They lie. First of all, these doctors don't do the laser surgery. They never have in their life, and they never will. But by saying that, then the patient thinks, oh, okay, well, maybe I'm not a good candidate. Yeah, you need a fusion, not laser. It's just corruption to the finest. Why do I tell you guys about this? Because I want you to be aware of their schemes, their entrapments. Can you imagine if no one ever told you that a crocodile is bad, and you go swimming in the Nile River? You're going to die. They will eat you. Okay? Or that spiders will bite you. I mean, I hope I don't get any spider lovers out there, but I'm sorry. I like animals, but spiders, I'm sorry, they freak me out. All right? They bite. They stick venom in you. Have you ever seen a brown recluse spider bite? Hold on. Damn, it's bad. Uh-huh. I've seen it in the hospital. It's bad. My point is, if someone didn't tell you about the dangers of the world, how long would your lifespan be? Walking across the street, right, when cars are coming. Someone has got to tell you about danger. And nobody's doing it for patients having spine surgery. So that's what we're doing. We're warning you all. Because the other doctors, they're on the take. They're the ones, they're the spiders and the crocodiles. Look at this piece of herniation, Henry. You see this one?
Yes, we do.
Right here. Just put it right there for display. We had a lot of those that came out. Last one, Dr. B, 10 minutes. 10 whole minutes. And here we go.
We have a couple more questions.
I will take them all.
This next one coming from Justin K, once more on YouTube,
All right, Justin K.
asking how do you get multiple discs from the same incision?
Ah, Justin K. Great question. Not many surgeons know how to do that. I have learned to do it. I used to do one incision per disc. And then I started thinking, some of these incisions are awfully close to each other. Why make two incisions when you can make one? So I just started playing with it, you know? And I wiggle the skin a little, or a lot of it has to do with where you choose your entry point, right? Where you go in, like the first incision. And it turns out that L5-S1 is the hardest to get into. So I always start with 5-1. If I'm doing a 5-1 on that side, I start by placing the needle in 5-1. Then I use that as my entry point in the skin. I make an incision there. And then I just try to get the other disc. Now, 9 out of 10 times I can do it because of the angle of the disc. The discs all, if you look at them on an MRI and you draw a line to them, they all kind of run back towards almost the same place on the skin. So it turns out that they map back to the same spot. And that's what I do. I just map them back and I use that spot as the entry point. Oh, this herniation is stuck. Doesn't want to come out. That's why we have a laser. Anyway, I'm going to try to grab as much of this herniation as I can. Sorry about the poor visibility. Those are all pieces of herniation lining up to get out. Oh, by the way, look at the blast marks on the metal right there, those little holes. That's melted steel. So, don't believe these surgeons that tell you laser cannot remove bone spurs. Yes, it can. It's just we don't want to remove all the bone spurs because it's not necessary. I don't even take all the herniation out because it's not necessary. I only do what's necessary to get rid of my patient's symptoms and keep them away for the rest of their life. Grabber. Any other questions?
Yes, we got a couple more questions, and this next one coming from Siddhartha on YouTube.
Oh, I like Siddhartha.
Asking, is it true that Tiger Woods had an ALIF or a fusion and then won the championships again?
Not to my, I don't know what,
I think he never won out.
he never won after that, yeah.
I'm not sure.
Yeah, it's not true. Tiger Woods had a few back surgeries, including a laminectomy and a microdiscectomy. And then he had a fusion because all those other surgeries failed. As I tell you guys every single day, laminectomy and microdiscectomy are horrible surgeries. Fusion is a bad surgery. Can you imagine Tiger Woods, what happened to his drive? I mean, when you fuse that spine, you're losing movement permanently. With our procedure, we don't lose any movement, huh? Yeah. Your back becomes stiff. More importantly, you get adjacent segment disease. So, you know, you might feel good for a year and then you're going to be hurting again. And so they're going to want to do another fusion. So, yeah, Tiger Woods did not win after his fusion, not
Yeah.
to my knowledge.
He won in 2019 but had the surgery in 2021. Just looked it up.
He won in 2019 had a surgery.
What did he win in 2019?
The
Ryder's Cup?
Masters.
Oh.
Yeah, in 2019.
All right, so what, he had a fusion in 21?
Yes.
All right, so I guess what's happened... No, what happened was he had the laminectomy probably before the championship win. And he just suffered through it, and then he got a fusion afterwards. He's like, God, I can't take this pain anymore. Anyway, point is, he could have avoided all of that, and he could have been back on top if he had this surgery instead. Unfortunately, he didn't know about it. And had he known about it, he would have made the right choice.
We have a couple more questions.
Sure.
Next one coming from Rich on YouTube.
I hope you are. Go ahead.
They asked Dr. Deuk, can I send my cervical, thoracic, and lumbar MRIs for a total estimate?
Yeah, Rich, you can. So what Rich is asking is, can I send all my MRIs? The answer is yes, but the reality is we only do one body part at a time. And I will tell you this, Rich, please don't misunderstand what we do. I do not look at your MRI and recommend surgery. I talk to you on Zoom. I examine you on Zoom. I look at your MRI, and then I recommend a treatment. But I cannot tell you what needs to be fixed on your back or neck based on an MRI. I need to see the patient. I need to examine you. I need to know where your pain is, your symptoms are. That's very important. Okay? I would never operate on somebody just based on an MRI. Because most back pain is seen on an MRI if you know what you're looking for, but you've got to talk to the patient to make sure that you're targeting the right spot. I've seen people with lots of bad discs on their MRI and they have zero disc pain. They have pain from a piriformis, and then we do a piriformis release and they get all their pain goes away. And so you can't see that on an MRI. My point is, very simply put, the diagnosis is made clinically as to what causes the pain. 5 minutes, Berndes, 5 minutes. And you have to be really good at diagnosing. And there's nobody in the world better than us. We use a pain map called the Deuk Spine Pain Map. There it is, the end of the disc. as we know it. Any other questions?
Yes, so far we have about 2 more questions. Next one coming from JG on YouTube,
Bring it.
asking, thank you in advance, going on 8 years with my herniations, does scar tissue growth have a limit?
So I honestly did not really hear that question. 8 years is all I heard.
Oh, sorry about that. They said, going on 8 years with my herniations, does scar tissue growth have a limit?
Oh, I see. Yeah, if you've had the herniations for 8 years, you've had 8 years of scarring. Does it have a limit? No. But I will tell you this, the more scar tissue you get around the back of that disc, the more like this stuff you see right here, real thick, that's right there, that's scar tissue I'm zapping right now. See the goldish color? That's calcium. That's like hard stuff. So it just starts to pile up slowly, bigger and bigger and bigger, and the nerve is right here. So the nerve gets pinched. And, you know, at some point you're going to be like, oh God, you know, I can't take this leg pain anymore. And you're going to go see a doctor and they're going to tell you laminectomy. That's the worst thing you can do. Don't do laminectomies. It's the wrong surgery. Wrong for you. Right for the surgeon. Wrong for the patient. Almost done. About 2 minutes left. And we'll be done with this lady. 5 levels. Whew. What's the next question?
Next question.
So to answer, no, there's no limit to how much scar tissue your body can produce. As long as the herniation's there, as long as you're living, eating, and breathing, you will make scar tissue.
This next question is coming from Jeffrey on YouTube.
By the way, that's why people's back pain gets worse over time, because they get more scar tissue and inflammation. Yes, I'll take Jeffrey's question.
Question from Jeffrey asking, this is my first time tuning in. I find it very interesting, but I am leery of anyone that feels they need to cut down others in their field to promote their own work. Am I overthinking?
I don't know. Do you like the Avengers? Do the Avengers cut down the bad guys in the end? Yes, they're still the Avengers. They're saving the world. So you got to cut bad people down to save the world, my friend. So yes, I think you're overthinking. All right. We're done. I don't really see anything else. Maybe that little piece right there.
It's not like it's a contractor talking about another contractor. That's different.
Yeah, contractor. Besides, I'm human, man. I make, you know, silly mistakes. I'm a sinner. Come on. Let me sin. All right. Any other questions? We're done.
No current questions.
We have literally cleaned out 3 tears, 3 herniations, and this patient did amazing because she has the best team here, best anesthesiologist around, Dr. Berndez, the man, the myth, the legend. And, whoa, by the way, we did it all through 2 little cuts that are the size of Band-Aid. And by the way, I'm glad you're tuning in. A lot of the people in this room here watching, Facebook, YouTube, Instagram, they've been around for a long time watching us. And there may even be people in this live stream that have had surgery here. We get a lot of our past patients. I can't tell you who they are. This goes against HIPAA violation, but I can tell you we get a lot of them. They can tell you, but I cannot. Beautiful, beautiful, beautiful. All right, Luis, you did phenomenal. Thank you. Thanks, everybody. Great job. Henry, let's show our audience, you know, one of our patients.
Copy that.
And good morning, I'm Dr. Deuk Majan here with a patient from Kentucky who traveled here to Florida for the cervical Deuk laser disc repair. And he had 3 bad discs. And good morning, I'm Dr. Deuk Majan. I'm here with a patient who's traveled from North Florida to visit us for his back pain. You came to us yesterday with 55 years of chronic back pain. You still have that back pain today?
I do not have that back pain today. I'm a little sore, but no back pain like I've had for 55 years. I got it 55 years ago when I was serving in Vietnam and had a helicopter incident and also a car accident over there. I have had chronic pain since that time and have had injections. None of that has helped, and I've gone through therapy and all sorts of things, but it wasn't until yesterday where you did some remarkable things to alleviate that pain that I've had for so long. I think the soreness is going to go away pretty soon.
Yes, it is. So you had disc pain and you had facet joint pain, both. We did the Deuk laser disc repair for the disc pain. With the laser, we went in and we cleaned out those 2 discs. You could see the tears in there. That's where your pain was coming from the discs at L4-5, L5-S1. Then we did your facet joints because they were full of arthritis. You had degenerative disc disease and herniated discs along with facet joint arthritis. And we were able to treat all of those areas. Your pain is now gone.
Pain is now gone. Yesterday, the day of our procedure, your operation, it was my 81st birthday. So
Yes,
that's
congratulations.
That's a really good birthday present.
How did it feel to have your first meal without that back pain that you've had for 55 years?
Pretty doggone good, I have to tell you that.
It's not going to take too long to get used to that, is it?
It won't take long at all.
Now, your surgery was outpatient. It took us about 2 hours to do the surgery. How long were you here recovering for?
An hour and a half or so, but not very long. Left. I actually went home, had a little lunch back at the condo we rented, and a little nap, and then I was ready for my French restaurant.
Very good. What's life going to be like now that you don't have that back pain anymore?
Well, I think I'll be able to walk further than I ever have. I haven't been able to walk in the last few years very far. I've given up golf, and I know I can't really do that for about a year, but I may try that again too, because I see new opportunities for me walking and being more free.
You can golf in 3 months. You can go back to your full game.
3 months, I'll take it up.
All right, is there anything else you want to say to your fans out there?
If you haven't tried this Deuk Institute, Spinal Institute, you really ought to give it a chance. I have been fearful of an operation in my back. I really and now find that this is the way to really treat the back problems. I've gone to various sports clinics. I really never had attention like this, but I have a friend that went through this just 3 months ago, and he is doing remarkably well, and that's what gave me the courage to call and say, I need to have a referral down there.
Congratulations.
Thank you very much, doctor. Really appreciate it.
Happy New Year to you and your wife.
Happy New Year, and to you as well.
Thank you. Hey, good morning. I'm Dr. R. Deuk Majan, CEO and founder of the Deuk Spine and Deuk Joint Institute. I'm here with a patient who's traveled from Pittsburgh to Florida. And what brought you here to the Deuk Spine Institute?
Well, I have had back pain for so long, and anything and everything we didn't help. My wife did significant research. We found you online, actually, is how it started.
Excellent. And what kind of procedures did you have done before you came to Deuk Spine?
I've had 5 lower back surgeries, 1 fuse, and the others laminectomies and so on, all within the last 3 years.
And they were recommending another fusion for you, weren't they?
They were. That's when I really began to research other options. When they mentioned another fusing, I absolutely was not going to do that. So that began our research that ended up finding you.
The Deuk Spine Institute. And what we do differently, folks, is we cure pain with one procedure. Patients don't have to keep coming back having multiple procedures and pain management. And that's kind of where you were. You were in that surgery, pain management, surgery, pain management, surgery, pain management, back and forth. And that goes on if you keep doing it for the rest of your life. But you found a way to get out of pain and you came to Deuk Spine. How do you feel today?
Unbelievable. I have not felt this good in years, several years.
And you feeling good because we put you on some new pain pill that nobody else has?
Absolutely not. I've lived on pain pills up to this point. I'm on nothing. I have a prescription for some muscle relaxers, no pain pills. I'm on nothing.
And how did Deuk Spine Institute fix your back?
Had the L3-4, L4-5 laser surgery, and then the rhizotomy that was done a few days later. A combination of those two, I'm pain-free.
Yeah.
I'm really pain-free.
I'd just like to point out that you, like many people, had more than one source to your back pain. You had discs that were causing the back pain, facet joints that were causing the back pain, sacroiliac joints that were causing the back pain, I think a piriformis that was causing the back pain. And because you were walking so funny, you were getting bursitis and other pain in your leg from the iliotibial band. We had to identify every one of those sources and treat everyone properly. And once that was done, it eliminates the pain permanently.
I have dreamt of feeling this way for years. Teared up a little bit this morning when I woke up. I could get out of bed without holding on to the wall, or it was just an incredible feeling.
Well, I'm very happy for you, and you could see we did your surgery with the laser, cleaning out your discs. Where did you go for your spine care? Was it a good center?
Prior to coming here,
Yeah.
I was at two major medical facilities in Western Pennsylvania and Eastern Ohio. Went through a lot of pain with the different procedures and surgeries I had done, and had no relief.
And what were these other facilities, you can say?
UPMC and Cleveland Clinic.
Yeah, two of the top spine institutions in the world, right?
Yes.
Great reputation,
Yes.
and yet they couldn't get you out of pain.
No.
And they were just ping-ponging you between surgery and pain management, surgery and pain
That's
management.
exactly what happened. Yes.
And there's no hope for actually getting cured because they don't have the cure to back pain. We do. Unfortunately, we've been trying to share that cure with them, but they're not interested. They just want to keep doing fusions because, well, let's say it, fusions make a lot more money than laser surgery does. It's hundreds of thousands, if not millions of dollars over your lifetime. That said, I'm glad you're doing well. When are you guys heading home?
Getting on a plane in a couple hours.
All right, very good. Is there anything you want to tell people out there in final remark?
I would just say that Deuk Spine Institute has been a lifesaver for me, literally. I would highly recommend it. I was being ping-ponged around for 5 years. I have dreamt of feeling like I feel right now for a very long time. So I cannot thank you, Dr. Patel, your entire staff. Everybody's been just incredible.
That's what we're here for, my friend.
Thank you, Doctor.
Give people back their lives.
Yes, thank you, sir.
All right, now go enjoy your top golf.
I will now. I will now.
All right, let's get you out of here.
Oh, I love those stories when people get better with our surgery. I'm Dr. Deuk Machen, and hope you enjoyed watching this live stream spine surgery Deuk laser disc repair. L3-4, L4-5, L5-S1 on the right side, L3-4, L4-5 on the left. Our patient presented with back pain, chronic back pain for years that started going down her legs on both sides. She's had shots, they wore off. She wanted surgery. There's really two options that work for this kind of problem, back pain, leg symptoms, and that is a multi-level decompression instrumented fusion, which I've done 1,000 of, or the Deuk laser disc repair, which we just did. The Deuk laser disc repair is far safer, faster, better, much better recovery. There's no metal or plastic put in your body, no hospitalization. It's outpatient. She's going to go back home in about an hour from now. So what did we do? How does all this work? Well, this is this piece of the spine, and this is obviously plastic, not a patient of mine. Anyway, plastic, bone. You've got a disc there. Right, Henry, don't get me started.
It took me a second.
You've got a disc here, which is the cushion between the bone. And if you look at a normal disc, right, it's almost like little bean shaped. And there's a tough wall around the outside and this weird jelly in the middle called the nucleus propulsus. And what happens is people get a tear in the back of their disc in the wall called an annular tear, and the jelly from the center pushes out and gets stuck in the tear, plus it sticks out. We call that a herniation. There's two parts to a herniation. There's the part that is stuck inside the tear, and there's the part that's outside the tear, around the nerve. You guys see that right there?
Yes, we do.
All right, so we came in from the back side and went right past the facet right into the herniation, and I use the laser to zap it away. Do we get 100%? No. People always ask me, why don't you get all the disc herniation? Because you can't. It's not possible. Anyway, she did great. I unpinched the nerves. I debulked the herniations, which is the best we can do in spine surgery. We didn't have to do fusion. We didn't do anything with her alignment. She's going to have her same alignment she has now. And the great news, she's going to be back on her feet today. She'll be walking around her home today. And she can be back driving tomorrow, going to work tomorrow, shopping, going to a U2 concert, right? She can do whatever she wants tomorrow with some minor restrictions. No heavy lifting, no driving a golf ball for 3 months, no jiu-jitsu, no MMA. Sorry. But there's lots of things she can do, okay? And most of our patients just have a little Band-Aid incision, you'll see. And the pain goes away. 90% of the patients it's gone by tomorrow. In 10% of our patients, it takes a few extra weeks, but it goes away in everybody. Never had a failure where it didn't go away. All right, let's take some questions.
First question coming from Lanu.
Lanu, what a surprise. Never heard of Lanu before. Hi, Lanu.
They asked, a lot of surgeries today. Aren't you tired?
Mm-hmm. As a matter of fact, Lanu, we have another one, and we had another one after this one. The next patient is from Manitoba, Canada, and he is going to be a longer case. When he did his MRI review, I saw he had 3 discs that needed to be fixed, but then he got here and he had facet pain and a left piriformis syndrome. So I told him about it and he wanted me to fix it. So we're getting all that done. We had another case after him, a 5th one, and to be honest with you, our anesthesiologist, Dr. Berndes, is feeling a little under the weather, and we decided that we were going to move that last case to next week. So we're packing them on again for next week, and we have a lot of cases next week. But we did have 2 more today, which is now going to be 1 more. Yes, I'm tired. You know, getting older, you get tired easier, and I'm not in the best of shape. I don't really run or exercise like I should. I need to, but thank you for your concern. It means a lot to me, and we appreciate it. Yeah, but I enjoy fixing people. I enjoy seeing them the next day and hearing about how their pain is gone and how it's going to make such a good impression on their life, and their quality of life is going to come back. I mean, that means everything in the world to me, to get people out of misery and suffering. So that's why I do it. Trust me, I've thought about retiring. I can retire. I could have retired 10 years ago. But the truth is I really love actually what I do. I love coming to work. I love helping people. I love getting them out of pain. But you're right, the schedulers have been, you know, taking advantage of my willingness to operate, and putting on a lot of surgeries. So it's kind of a double-edged sword. I love fixing people, but I do get tired. It is a long day, and my dogs are barking. So it is what it is, though. I'll never say no, and if the patient's there, I'll do it. All right, next.
Next question coming from, forgive me if I cannot pronounce this first name, but their last name, it goes by Amy.
Oh, Amy.
Amy on Facebook asking, I've been diagnosed with functional movement disorder, and it seems to me it stems from a pinched nerve at T6-7. Is this possible?
Yes, Amy, we can fix you. Don't believe what they're telling you. You don't have to live with it. We do thoracic T6-7 laser surgery a lot now. You know, 5 years ago, I wouldn't do the thoracic spine because it's more difficult technically to get there and fix it. But I had some patients that demanded it, and I did it, and the laser surgery worked beautifully for them. Our average relief of that pain is 99% permanent elimination of that pain from the disc. So you can get out of pain, we can fix you, you don't need to be functionally limited anymore, and you certainly don't need to live with the pain. You need to go to our Deuk Spine website, deukspine.com, and Henry may have posted a link. I think it's like mri.deukspine.com.
Correct, yeah.
And just go there and fill out the form, put thoracic pain. Send us your MRI images and report, and we'll schedule a Zoom, and then I will diagnose what's wrong, and I'll tell you what we need to do to fix it. And then you just decide if you want to get it fixed or not. So we can fix you, 100%, not worried about it.
That is it for questions.
Okay, so thank you for joining us. We got one more surgery in probably about 30 minutes, I think. So take a break, get some popcorn and cheese puffs.
Yeah.
We'll see you back soon. Bye.